Hello and welcome. I am doing my presentation on ART, Active Release Technique. I am really excited about sharing ART because I've had this done on myself, especially in college when I was playing basketball there, and I still to this day have it done. I see a chiropractor out in Lakewood, and they're all about healing through movement, and they do this on their patients, clients a lot. What is ART? So, it is by definition a patent movement based soft tissue technique. It was developed by Dr. Michael Leahy. It focuses on treating problems with muscles, tendons, ligaments, fascia, nerves, everything that we have discussed in class. It identifies and releases adhesions and scar tissues through movement. Who can use this? Chiropractors, physical therapists. It's underneath our scope and athletic trainers. It is a big modality in sports massage. So, how do you perform ART? First, we have the assessment phase. The therapist palpitates and tries to identify any abnormalities. Maybe there's some tension, adhesions, restriction in the tissue. And then we get into the treatment. So, the client is like moving the affected tissue at its full range of motion while the therapist is applying this precise tension at a specific angle and pressure. In the certification, they are really big on the specific angle and pressure that is applied to any pathology that could go on, right? Carpal tunnel, we'll go through that one real quickly, but yeah, they are very specific on whether or not you're going with the muscle fibers or against it, and it just depends on certain cases. And you learn that in the certification. And they typically do this treatment for 3 to 5 times. They say not to go over that because you do not want to go back into that acute phase. So, how to do ART on the forearm slash wrist extensors. So, the wrist extensors obviously originate from the medial epicondyle of the humerus and then go all the way out to your phalanges. We'll talk about the median. So, no, the last three fingers of your phalanges it goes out to, and those are the ones that carpal tunnel affects. So she's going to start at you know roughly where she can on the insertion of not the insertion, yeah, the insertion of the wrist flexors, and then she's going to do a nice deep glide all the way up to that medial epicondyle while the patient is flexing those fingers towards them and then extending them, right? Doing that full range of motion that we talked about. I even for this one had my chiropractor, he found an adhesion on my forearm near like that medial epicondyle, and he kind of like staged there and did a little bit of a trigger point thing with it while I was still flexing my fingers towards me and extending them away from me. And that is a, a technique that you could do within this scope. So, to go back over what I just discussed, I guess, again, they identified the issue. They found the muscle and tendon that needed to be treated. So, for this example, it was the forearm, those wrist extensors or flexors, and they were applying that contact going with those muscle fibers, right? Going at that precise angle that is recommended within ART, and all the while they're doing that nice glide, they are extending the fingers and then flexing them, right? Doing that full range of motion. And again, it could be a glide, it could be a deep touch. They could even do some sort of like a trigger point with it. And then they do it 3 to 5 times. Okay, so what does ART do to the body? Just kind of went over this, but just to reiterate, it breaks up adhesions and scar tissue, increases mobility and range of motion, reduces pain, inflammation, improves circulation and healing, restores optimal function health. And the biggest thing with ART, the main thing that they use it for is for any nerve entrapment. It definitely softens up that tissue and gives that nerve some freedom. So, yeah, what conditions respond well? Carpal tunnel syndrome, tennis, golfer's elbow, plantar fasciitis, shin splints, IT band syndrome, and thoracic outlet syndrome. Does exactly kind of what I just said, frees up those nerves. Um, and finally, like, why did I choose ART? There's something about healing through movement, and in our short time with, like, being at clinicals and doing these METs, right? This is very similar to pin and stretch and MET. There's something about like contracting the muscle and then strengthening, or not strengthening, stretching it all the way out to its full range of motion, and then putting our hands on it, kneading it, gliding it. I've been seeing these really hypertonic muscles just like melt like butter, and we're only doing it 3 times. So there's something behind this, and I'm like really excited to continue with it and do certain modalities that do like this kind of like formula of contracting it, stretching it, and then just kind of putting your hands on it. And it's very similar to yoga, right? It contracts, lengthens, integrates. Um, and I've seen yoga really heal a lot of people's lives. I don't want to like, get too, I guess, deep with it, but I it's healed my life, it's healed a lot of my students' lives, clients' lives, and it's changes your relationship with your body, changes your relationship with your mental state, and people are like actually having better qualities of life. So yeah, if you guys are interested to get certified, um you'd go through like the official ART certification website. um that it is very expensive, but there are different levels, right? The first levels is like lower extremities, upper extremities, spine, and then like when you get into the more advanced, you go through like more of like your masseters or like intricate accessory muscles. And they range from, some of these are like only a couple of days, some of them are like a full week long. Obviously the full week long is quite an investment. I was seeing like $5,000 for this one out in Colorado, and the ones that are a couple of days are a couple $100. I saw like 800, 500. So thank you for listening. I appreciate you guys, and excited to see what you guys have to present.